either for their x-ray or to be taken back to their rooms. This termite-riddled door is only a symptom of an overcrowded, overworked hospital. Only the dedicated staff makes it bearable. But the final cutback ordered by County Manager McNair brings criticism and warnings from the Dean of the University of Miami School of Medicine, who is also the chairman of the hospital's medical board, Dr. Hayden Nicholson.
The effect of the budgetary curtailment that was recently ordered certainly would not have been as serious if the hospital had been at a thoroughly adequate or superior level prior to the curtailment. But I think that it was operating at the ragged edge of adequacy before the curtailment was necessary.
What do you think of Dr. Nicholson's charge of poor patient care at Jackson?
Well, I can only say that it came as sort of a bolt from the blue. I certainly didn't expect a man of his caliber, his professional caliber, to make such a blanket statement. Certainly there are cases, I'm sure, of where it is thought that a given patient hasn't received all of the proper care. But this seems a condemnation of the whole hospital facility. I think it is not true on the basis of all that I have seen, and I've made visits at the hospital. I'm not a professional man, of course, but I've talked with professional men around, and I think, generally speaking, this is not true.
I think that there's not the slightest question that the statement is correct, and I think it is a rather restrained statement. I certainly could have enlarged upon it if I'd wished to. I don't think it was necessary. I think a brief, concise statement was just as effective as a more specific one would have been.
Dean Nicholson of the medical school made a charge that patient care was being impaired here at Jackson Hospital, and the health of the community, therefore, was being endangered. Thought on that?
Well, I have no thought that the health of anyone is being endangered by our cutback.
Is there a morale problem at Jackson beyond that which you've just outlined?
I would guess that there is, yes, Ralph. I think that there seems to be conflict at the top in philosophy and approach by the medical school people as compared with Dr. Gates and his staff. Usually I have found wherever such conflict exists, this tends to simmer down throughout the whole staff. Say on that basis that there is a morale problem at Jackson Memorial Hospital.
Even the job of refurbishing Army surplus chairs to save money was halted by the cutback order, and all but the barest minimum of maintenance personnel were either transferred or terminated from the hospital. Almost 200 temporary employees throughout Jackson were let go, and morale sunk to a new low. A bewildered and angry maintenance crew aired their gripes at a spontaneous meeting. The president of the Hospital Employees Union, with more than 500 Jackson employees as members, speaks to the group first.
I believe that if it's as the administration has stated, that costs have skyrocketed, then it is incumbent upon the county commission, the citizens of this county, to provide the funds to operate this hospital so that the patients here are not shortchanged, and the employees' welfare, put in years and years of faithful service, is just not washed down the drain. Every employee in this hospital has a specific job to perform. He's a cog in the wheel.
We want people to tell us these things, these people that are in charge, to tell us things to start with, just what's happening here. Then all of a sudden, the layoffs started, and the way they put it, that we're responsible. These people in maintenance are responsible for this big budget deficit. We don't feel that way. We want people in higher places into this as taxpayers and employees.
It's a general breaking down of the Metro civil service system. It's a pseudo-civil service. It's not an actual civil service. What they have done here will boomerang throughout the entire county, and it is not the fault of the men who are being laid off or otherwise being pushed around. as a result of misappropriation of the money for one reason or another in the higher echelons. We are the men who are going to suffer. We are the men who are going to pay the price and the scapegoats for being the low men of hope.
Your current operating budget, though, Doctor, is over what had been allocated. What is the reason for this?
Well, first, we started out to train some people for our opening of our mental health. We have to employ these people when they're available, so to speak, in the skills, particularly in nursing and psychiatric aides. Then we experienced an extremely high census during January, February, and on into March. Actually, we've had as high as 46 patients more than we're budgeted for on any one day, and our general average has been well over 1,100 that during these months that we are budgeted for. Now, actually, if you have to employ additional people to care for these patients, your payroll budget is going over, and of course your doctors are writing orders both for medical supplies and drugs, which are the two critical codes that we're in short supply at the present time as far as money is concerned. Over these things, of course, the director of the hospital has little or no control. If a patient needs drugs, the doctor writes it, and it's up to the director to furnish them. So I think these are the main reasons that we're in trouble as far as our allotted per diem cost is at the present time.
We want to know how these people on top feel, how the people in Dade County, and above all, as employees and taxpayers, where's this money going? Are they blaming small people like myself? I mean, I'm a welder. I'm a damn good welder, excuse me. But I'm working here because I feel that someday I'm going to have a definite security. I have my house now and so on. I got a small boy, 4 years. I got to bring him up. And when things go on like this that I know nothing about, then I think a letter had to be, something had to be done to find out how we stand. If this started in maintenance, it's good. We want it to continue all over the county. I don't want to work for Metro or anything on that order. If somebody can promise me something in writing, a permanent position, and people that we have here don't tell us anything because they are apparently too high up in echelon to even talk about things like this.
Some of the personnel here have complained that the recent cutback which you initiated